I'm your host, Dr. Jack Braha, and welcome to the Medcastplus show. On Medcastplus, we feature your local community physicians and healthcare professionals who are experts in their field and who will share their experiences and knowledge. I invite you to visit our website, Medcastplus.com, and follow us on social media. Today, our guest is Dr. Ilya Blokh. He is board certified in internal medicine, hematology, oncology, hospice, and palliative care. As you can tell, he's a pretty important and well-trained individual. He has been in practice here for over 10 years and has been a part of the Brooklyn landscape for quite some time before that. I am honored to not only have him here on the show, but also to work with him. Dr. Blokh takes care of my patients at times, and I work with him at some of the local Brooklyn hospitals. Today, we will discuss a few topics related to hematology, the study of the blood. Also, it is March, and that means Colon Cancer Awareness Month is upon us. We will discuss how we can prevent colon cancer and touch on how it's treated and detected. Welcome to the show, Dr. Blokh. It really is a superb honor to have you here. You have been a part of Brooklyn healthcare for quite some time. Welcome. Thank you for coming.
Thank you, Dr. Braha. It's
So
a pleasure to be here.
Tell us a little bit about where you practice here in Brooklyn.
So I'm on Kings Highway, right in the middle of Brooklyn. It's nearby Mount Sinai Hospital of Brooklyn and Community Hospital of Brooklyn. The practice is pretty much a general hematology-oncology practice. Treat the most common types of anemias, problems with the white count, platelet count, problems with colon and breast and leukemias, pretty much the common maladies that affect people as relates to hematology and oncology.
Right. So as a hematologist, you study the blood, we treat blood disorders, and as an oncologist, which is the study of cancers, tumors, this is not only cancers that we think of like tumors that grow in our colon or in other parts of the body, but also blood type cancers as well.
Correct. People think oncology is simply cancers of solid organs, but unfortunately people get cancers in the blood. It could be cancers of white cells, cancers of red cells, cancers of platelets. So there's a whole array, whole gamut of different types of cancers that people could have.
And this is what you take care of over on Kings Highway in Brooklyn.
Yep, I'm proud to be in Brooklyn. It's a wonderful place to work, very diverse population, and I get to really meet people from all walks of life.
Brooklyn is the incredible melting pot. I agree with you. I enjoy practicing here. You see everything in Brooklyn. But before we delve into hematology and oncology, let's learn about Dr. Blokh. I know you weren't born here. Where were you born?
Actually, I was born in Kiev, Ukraine. Came here in 1979. At that time, we had communism, so there's a whole different type of life living in the former Soviet Union. And I got to thank my parents for bringing me here because there's nothing like coming to America and living in New York.
So 1979, you arrived. Did you come straight to Brooklyn or did you go somewhere else?
Well, actually, there were no direct flights at that time. So we had to first go to Austria, then Italy, and then finally to America.
And then you arrive here and in Brooklyn. You went to school in Brooklyn, right?
Yes. I consider myself essentially a Brooklyn guy. I came here, I was 4 and a half. I went straight to Canarsie, grew up in the Bayview houses there, and went to public schools literally from kindergarten through medical school.
So you were really Brooklyn bred. And so you went to Brooklyn Elementary, Brooklyn High School.
Brooklyn College.
Brooklyn College, but I understand that you were so smart that you were accepted directly into medical school, essentially.
Actually, it was a special program from high school that took students in a combined Brooklyn College, SUNY Downstate. So I kind of got the best of all worlds. I got a chance to get into medicine, and I got a chance to experience the public school system and the state system by going to CUNY Brooklyn College and SUNY Downstate.
Both excellent
I'm very proud.
Educational resources here in our institutions here in Brooklyn. So you went to Brooklyn College, you spent some time there studying the pre-medical courses, then you moved on to Downstate.
Yeah, actually in Brooklyn College I studied political science. I kind of wanted to get a little bit different feel for things other than medicine. So I studied political science at that point, and then I went to SUNY Downstate.
Yeah, I agree with you. In college, it's important when you know you want to be a doctor to not just focus on science and science and science. You have to be well-rounded. So you studied political science, which probably helps a lot in these days right now. But you then went on to Downstate. How does someone decide to become a hematologist-oncologist? Because, you know, when we talked maybe before we were in medical school, the word cancer was always cancer. It it was whispered amongst people. You know, thinking back to Neil Simon's plays where, you know, he gets on, one of the actors on stage would whisper cancer because it was such a bad word. And it still is, and it scares people. And to move into this field where, you know, people are just so frightened by the diagnosis, how does one really build up the courage to go into hematology-oncology? What made you decide to do this?
Well, I kind of wanted to be a doctor from many, many years, literally since, I would say, high school, junior high school. But specifically, hematology-oncology was from downstate. I had these old-timer professors, and, you know, they kind of practiced old-fashioned medicine. They would come to the bedside, they would actually examine the patient from head to toe, the eyes, the ears, everything. And my best mentors were hematologists, oncologists. They were kind of tough doctors, tough on the students, tough on their residents.
Did they beat you up with the questions on rounds?
No, but they made their residents cry.
They made their residents cry.
They were really tough. But at the same time, they were tough because they wanted the patients to get the best care. They would always say that they were advocates of the patient. And they really advocated for their patients. In SUNY Downstate, Kings County, they made sure everything was done for them. And I really respected them, and they really inspired me to go into the field.
Yeah, I think that's true of all of medicine, that our mentors have a huge influence on what we end up doing in our lives. Same with me, with my mentors, watching how they practice. I still try to do that. And I can tell you that for our viewers today, Dr. Blokh, who's a hematologist-oncologist here in Brooklyn, does that amazing bedside care. I've seen him interview patients. He takes a history. He finds out everything about his patients because it's important to know everything about our patients. And so you went into hematology-oncology. Where did you train?
Well, I trained in residency at Long Island Jewish. And from there, I had the pleasure of meeting Dr. Rai, who developed the famous Rai classification for CLL. And Dr. Rai, I mean, pretty much is friends with almost everyone in the field. So through him, I got a chance to travel and meet some of his friends. So I went to St. Vincent's, the Royal Marsden in London, and met a lot of his friends, and they really, really inspired me further on. And from there, I knew that I wanted to do a fellowship in hematology-oncology, which I did at Stony Brook.
So you're out in Long Island at Stony Brook. You spent how many years as a hematology-oncology fellowship?
3. It adds to the 3 of residency, so that's 6
and the 4
already.
of medical
and
school.
Exactly.
So 10 years after college, still spent training into this field of hematology-oncology, and you are board certified in 4 specialties: medicine, hematology, oncology, and palliative care, hospice care. Quite an accomplishment.
Oh, thank you. Well, the hospice palliative care, they don't really teach a lot of that stuff during training, and I felt that to be a good oncologist, you really need to know a lot of things that are taught in hospice and palliative care. Looking at the patients from a biopsychosocial model, treating their symptoms, some of the ethical issues involved, end-of-life care. A lot of these things are emphasized in hospice palliative care, but not necessarily in hematology-oncology training and fellowship. So I really wanted to kind of get a little more experience with
that well-rounded training and approach to cancer care is so important because many times patients with cancers are not able to cure the disease. They're able to battle it. But a component of that care, at least I see with my patients, has to be what you just brought up of end-of-life care and really creating a plan for the patient, you know, a whole person plan of treatment, battling the disease. And what happens when we realize that, hey, the end is not going to work out how we expected, and providing that care that you're board certified in?
Well, what they say about hospice palliative care, it's family care. It's really geared towards the patient and the family. It's respecting the family's wishes, the patient's wishes. It's realizing that once the cancer can't be cured, it's very important to treat the patient's symptoms, make sure they're comfortable, and really knowing what the goals of care are for the patient. Often I also have to differentiate between hospice and palliative care, and the two are similar but not quite the same. So hospice is really when we decided we're not going to treat the cancer aggressively, that the cancer is terminal, the prognosis under 6 months, and really the patient and the family decide that they weren't going to pursue aggressive treatments.
Aggressive meaning chemotherapy
Exactly.
or surgeries.
Exactly. But palliative care is symptom control. It's recognizing that you could actually still treat the cancer, but not to forget about the symptoms. Patients getting chemo, radiation, getting all kinds of procedures, they could have nausea, they could have shortness of breath, they could have bowel problems, they could be in pain. And palliative care addresses the symptoms, and you actually can be treated and can receive palliative care.
This is all part of what we consider comprehensive cancer care, correct? This is the 360 model of identify the disease, how are we going to treat the disease, how are we going to treat it within the goals of the patient. Not everybody wants to go for chemo. Some patients just want to be made comfortable, and so you provide that 360-degree, full circle type of comprehensive care. Let's move on to some of the conditions that our viewers might be thinking about. We're here with Dr. Blokh, who's a hematologist-oncologist in Brooklyn. And one of the most common things I see in my practice as a gastroenterologist is anemia. People come to me with low blood counts. They want me to figure it out because many times it's from bleeding in the belly or bleeding in the colon, but not always. There are many, many different causes of anemia. And I want you to explain to our viewers, first of all, what is anemia? They hear it all the time, but what does it really mean for the layperson?
Well, anemia simply refers to low red count, low hemoglobin. It could be either causes destruction, where the red cells are being destroyed. It could be an issue of production. They're not being made by the bone marrow. The bone marrow is the part of the body that actually makes the red cells.
And where is the bone marrow?
The bone marrow is in the bones throughout the body, but the biggest sites are usually in the sternal area and in the hips. And that's why when we assess anemia and the cause is not well known, we do what we call a bone marrow biopsy. We go into those parts of the bone that make the red cells.
And you do that yourself, correct?
Yes, I do that, or what I do is actually also have the radiologist do that. And the unique thing about the radiologist doing it is the patient's not in pain. They give anesthesia, and a procedure that used to be very, very painful, the patients don't feel anything.
So now one of the tests that you do routinely when you cannot figure out why somebody is anemic is a bone marrow biopsy, and it can be painless. It could be a painless test.
Correct.
Okay. So tell us, what are some of the main causes that you see in your practice, especially here in Brooklyn for our patients in Brooklyn? What are some of the most common causes of having anemia or a low amount of red blood cells?
Well, for younger patients, especially menstruating females, the most common cause is iron deficiency from heavy periods. I mean, women bleed every month, and then when they're heavy, that's a cause of iron deficiency anemia. Now, once you get to middle age for women, very important to rule out bleeding from the GI tract, meaning from the stomach, from the colon, anywhere literally from the mouth to the anus. In men, it's always ruling out a bleeding source. That's always the main thing I want to not miss, and I check that by checking iron level. If the iron is low, that means they're losing blood somewhere. Usually.
So the gastrointestinal tract, meaning anywhere from the mouth down to the rectum, we can be losing blood from things like ulcers or cancers or blood vessels that are abnormal. What are some of the other parts of the body that might contribute to blood loss?
Well, anyone who's bleeding anywhere in the body could get anemic. For example, I've had patients where they have iron deficiency anemia, and they are checked. They get endoscopy, colonoscopy, and there's still no evidence of bleeding. So we do a CAT scan. We look for any kind of bleeding masses. People bleed from kidney masses, from any other source.
So with the kidneys and the urine, you check the urine for blood?
Correct.
Right.
It's a simple blood test. It's a simple urine test.
So the gastrointestinal tract, urologic tract, these are sources of bleeding which can lead to anemia. What else can cause anemia? You mentioned that there is a problem with producing or a problem with destroying. So the body's always in a flux of making blood and removing the old blood cells. What are some of the disorders that can lead to problems with making the blood or destroying the blood too quickly?
Right. So the iron deficiency is when they're losing blood from bleeding or rarely from not absorbing. If it's an issue with the bone marrow, there could be blood cancers. For example, there are cancers like MDS, which is called myelodysplastic syndrome. This is a cancer of the bone marrow. It's also called pre-leukemia.
So this is a cancer of the factory where the bone,
exactly.
where the bone marrow is making our blood cells.
Exactly. The cells are made immature. The cells are not normal cells, and the hemoglobin production is diminished.
So that would be diagnosed by a bone marrow biopsy?
Correct. The bone marrow biopsy actually goes into the bone marrow. We get to look at the cells under the microscope. We get to run specific cytogenetic studies, genetic studies on those cells, and they really could home in on the cause.
So what are some of the causes of too much destruction of blood cells?
Well, destruction typically is seen in autoimmune hemolytic anemia, so any kind of hemolysis or destruction in the blood.
Hemolysis is the lysis, the breakdown of the blood cell.
Correct.
And this can occur with?
So it could occur with antibody production, where the body has its own antibodies against the red cells.
So the body is actually attacking the blood cells.
Exactly. It's an
Okay.
autoimmune process, meaning the
Right.
body itself is destroying the red cells. And the way we treat it is with steroids, which kind of try to slow down and calm the immune system. And typically, it is an effective treatment. Sometimes you get destruction from mechanical valves. That's another cause.
Those are the valves we're talking about in the heart that
Correct.
people get. Right, so what happens with the mechanical valves in anemia?
Well, as the blood circulates through the heart and it hits the valves, there's a certain kind of shear and destruction of the red cells. And that gives a destructive process that could cause anemia.